Today, we are going to discuss general surgery. Actually, this general surgery and general medicine are a little bit confusing for preparation of NEET exam. Last time, this general surgery and medicine, lots of questions comes from this aspect. Okay, so to study general surgery and general medicine, you need to be very thorough with basic subject. So once you have come across these basic subjects, this general surgery and medicine, it is very easy to understand and easy to crack. So how you are going to study? So the success does not come from what you do occasionally. It comes from what you do consistently. That is the key. You need to study this surgery and medicine day to day. Means you need to revise the basic subjects. So you need to thorough with the basic subject. Once you have done that, it is easy for you to study this general surgery and medicine. So since the basic subjects are not covered, so we will start with the very basic topic. So that is fluid and electrolytes, or IV fluid, intravenous fluids. So how this fluid and electrolytes is balanced in our body? So that is by actually the water regulatory method. So that is the primary method, that is a regulation of the volume of liquid ingestion and regulating the volume of urine excreted. So the total daily requirement for water is around 2 liters, that is around 2000 ml. And another important part is that the volume of 30 to 35 ml per kilogram per day meets the daily maintenance needs. That is the key. A volume of 30 to 35 ml per kilogram per day meets the daily maintenance needs. And coming to the electrolytes, mainly two electrolytes are very important for body. One is sodium and other one is potassium. And the sodium, the daily requirement is 1 to 3 millimole per kilogram per day. And the potassium requirement is lesser, that is 1 millimole per kilogram per day. So that is a nutshell of the body water regulation and the requirements of water and electrolytes. So how this mechanism happens? That is the ADH mechanism. So ADH mechanism means once the water content of blood is too high, means what will happen? There will be ADH and ADH inhibitory mechanism. So through this water is regulated. And what is the total content, compartmental division of the water? So that is the intracellular fluid compartment belongs to around 65%, and the extracellular fluid compartment comes to around 35%. This 35% includes the interstitial fluid, plasma, lymph, and synovial fluid, cerebrospinal fluids, like that. So this extracellular fluid belongs this 35%, that is the interstitial fluid, plasma, lymph, and transcellular fluid, that is cerebrospinal, synovial, serous, and fluid. So this is 65 is to 35. And so once these disruptions happens in this mechanism, it will leads to dehydration. Suppose a patient comes across with a dehydration, how will you diagnose? That is, the patient will have increased thirst, fatigue, dizziness will be there, headache will be there, and decreased urine output will be there, and patient may experience with the dry mouth, and there will be loss of skin elasticity, and the patient will be very irritable. So these are the symptoms of dehydration. So once a patient comes across with the dehydration, how will you manage? So that is the fluid replacement therapy. So What are the different types of intravenous fluids? That is, one is crystalloid, other one is colloids, and there are some intravenous fluid which is used for special purpose. So examples for crystalloid, one is dextrose, ringer lactate, all belongs to crystalloid. And this colloids belongs to, that is, gelatin, Heta starch, dextran 40, all in the colloids session. So what is the difference between crystalloids and colloids, and what are its advantages and what are the disadvantages, and we will come across that. So a colloid means it is a homogeneous non-crystalline substance consisting of large molecule or ultra microscopic particle of one substance dispersed through a second substance. So what are the examples? The examples are gels, salts, and emulsion. So here what is happening? The particles do not settle and it cannot be separated out. It cannot be separated out. And what about the crystalloids? These are the substance when dissolved will form a true solution rather than a colloid and is able to pass through a semi-permeable membrane. So that is the difference between colloids and crystalloids. Colloids, what will happen? These are examples are gels, salts, and emulsion, and the particles do not settle and cannot be separated out. And in crystalloids, what will happen? It forms a true solution rather than colloid. And one more thing that is very important, it can pass through semi-permeable membrane. It can pass through semi-permeable membrane. So the crystalloids can pass through semi-permeable membrane, colloids cannot. So what is the importance of this in fluid management? We'll come to that. So these IV fluids crystalloids, it can be divided into isotonic, hypotonic, and hypertonic. And colloids, it can be it can be divided into blood products, and plasma expanders. And examples for isotonic are normal saline, ringer lactate, and glucose water. And the hypertonic, that is normal saline 0.45%, and the hypertonic are normal saline 3%, and glucose water 10, 20, and 50%. So these are the different types of IV fluid. That is, one is colloid and other one is crystalloids. And what are the this category? That is the special purpose. This sodium bicarbonate are used to address the acidosis in the body. And what about mannitol? Mannitol is a primary drug, primary IV fluid of choice when you are suspecting brain injury. So if there is a brain injury, there will be always a chance for brain edema. So once the brain edema happens, what will happen? There will be shifting of the brainstem to opposite side. So what will happen? There will be compression effects. So to reduce the brain edema, we need to give mannitol as a preventive method, or to prevent the brain edema. So these are the sodium bicarbonate and mannitol. And so what are the advantage and disadvantage? So in crystalloids, they are cheap, non-allergic, and there is no transmission of infection. That is very important. So what is the example for crystalloid? That is normal saline. Through normal saline, there is no transmission of infection. And there is no interference with the coagulation also. That is very important. But being crystalloid, they can pass through semi-permeable membrane. So once the saline is infused into the body, the fluid may wash out easily because it passes through a semi-permeable membrane, which is not happening with the colloid. So there will be higher volume of crystalloids required, and relatively short amount of time remain intravascularly because it crosses semi-permeable membrane, so it will be easily washed out. So crystalloid, you take it as an example as saline. It is cheap, non-allergic. There is no transmission of infection and no interference with the coagulation. But a very high volume is required and relatively short amount of time remain intravascularly. Then, what about colloids? Main advantage is it expands the plasma volume far superiorly, and it may be salt sparing. So the advantage of colloid is it works as a plasma expander. And what are the problems with the colloids? They are expensive. There is a risk of allergy. There will be coagulopathy. Itching may be there, and it may exacerbate the tissue edema. So that is the difference between crystalloid and colloid. So crystalloid, you may require very high volume, and it relatively stays in the intravascular for a particular very short time. But colloids, it acts as a plasma expander, but it is expensive. There will be a risk of allergy, coagulopathy, itching, and may exacerbate the tissue edema. Okay. So what are the commonly used solution? So one is the 5% dextrose. So what is the function of dextrose? Mainly, it supplies calorie. It supplies calorie. Being it is isotonic, and in most cases where blood volume replacement along with some nutrition is required. So whenever a nutrition or calorie is required, you can give dextrose. So especially in immediate postoperative period, because immediate postoperatively before procedure, the patient may be under fasting before a general anesthetic procedure, right? So immediate postoperatively, you have to supplement with calorie and nutrition. So for that, 5% dextrose is the solution we are usually using. And the another one is isotonic 0.9% sodium chloride solution. So it is also isotonic, and it contains sodium and potassium in concentration almost similar to plasma. Okay, so and the another thing is that it should not be used in first 24 hours after operation due to natural sodium conservation, that is due to this adrenocortical activity that is activated during the trauma or during a stress time. Okay, in stress time, the adrenocortical activity will be there, so this leads to natural sodium conservation. So you are not supposed to give more sodium through sodium chloride solution, that is 0.9% saline. So immediate postoperatively or immediate any stressful condition or trauma, the saline is not indicated. And the next one is the Ringer lactate solution. So this it contains all the electrolytes as in the extracellular fluid, and it is best in the hypovolemic shock. It is best in the hypovolemic shock. And but the main disadvantage is it is slightly hypoosmolar with respect to sodium chloride. So this is dextrose. It is mainly caloric and nutrient in purpose. Sodium chloride, it should not be given in immediate postoperatively or during stressful condition because there will be natural sodium conservation. Ringer's lactate solution, it is mainly used in hypovolemic shock. Hope you understand the indications. Then The osmolality, this is very important. You at least you have to remember the normal saline osmolality, that is 308, Ringer lactate osmolality, that is around 275, 276, like that. So these two are important. One is Ringer's lactate and other one is normal saline. And we'll come to the questions directly. Okay, the fluid which usually given in post-operative time. The fluid which usually given in post-operative time. So what could be the answer? Immediate post-operatively, yeah, very good, very good. Immediate post-operatively, we need the calorie or nutrients. So you have to give dextrose. And which fluid should not be given in post-operative time, or which should be given under closed monitoring? Which solution? That, yeah, that is normal saline. That is normal saline. Okay, so here the answer is dextrose. So, and if what is the main problem if you are giving glucose in trauma and trauma patients? So what will happen? This will produce lactic acidosis in some cases. This will give lactic acidosis, and also it may lead to hyperglycemia. So these two things should be understand if you are giving in post-operative time. In healthy individual, 5% of the infused glucose is directed towards the lactate formation. So, but in critically ill patient, 85% of glucose is diverted into lactate production. So when a circulatory flow is compromised, infusion of 5% dextrose solution can result in acid production and significant elevation of serum lactate. So that is important. That is when a circulatory flow is compromised. And another important aspect is it may lead to hyperglycemia. That is, if you are not controlled the dextrose, it may lead to hyperglycemia. That leads to increased chance of infection and ischemic brain injury, like that. Okay, so even if you are giving dextrose in post-operative time, you need to be understand the problems with the such dextrose infusion. Okay, and the another important things are plasma and albumin. It can be given, it should be given in burns. It should be given in burns patient. And normal saline, it can be given in vomiting or diarrhea. Normal saline can be given in vomiting and diarrhea. And it is already discussed, that is Ringer's lactate is indicated in hypovolemic shock. So following trauma, there will be a reduced excretion of sodium, that is already explained, that is adrenocortical activity. So plasma and albumin should be given in burns, normal saline vomiting diarrhea like condition, and Ringer's lactate in hypovolemic shock. And the another one, that is second, that is Hartmann solution is. So what is another name for Hartmann solution? Any idea? Hartmann solution. I will give you one clue. It is used in hypovolemic shock. It used in hypovolemic shock. Yes, very good. That is Ringer's lactate solution. It contains all the electrolytes, so it should be used in hypovolemic shock. So in hypovolemic shock, the IV fluid of choice is Ringer's lactate. The other name for Ringer's lactate is Hartmann solution. Hope it is clear. So 1 liter compound of sodium lactate or Hartmann solution contains calcium, potassium, sodium, chloride, and 28 millimole per liter of lactate. Okay, and the osmolality is around 276. Osmolality means even though the effective osmolality is 248, the lactate does not count. So osmolality means that is the transmission of fluids from one compartment to the other compartment. Okay, and this IV fluid have different. IV fluid has to move from one compartment to another compartment, intracellular to extracellular, like that. So the osmolality should be all the values of the different osmolality of different IV fluid you should be familiar with. Okay, so the answer is Ringer's lactate. And the lactated Ringer solution advanced contains which of the following electrolytes? It's already discussed in the last slide, right? So what is the answer? Sodium, potassium, calcium, and magnesium chloride. All the above. Yes. So it contains all the electrolytes. So the answer here is D. It's already discussed. And the another important one is Darrow solution. Okay, this Darrow solution contains more potassium. Since it contains more potassium, it is the best solution for hypokalemia. It is the best solution for hypokalemia. So what are the first symptoms or signs of hypokalemia? In hypokalemia, the organ which affected usually is heart, that is cardiac muscle or muscles. Okay, so that is another important aspect, that is hypokalemia affects mainly muscles, and in that the cardiac muscles. Okay, so the Darrow solutions contain more potassium and it is the best solution for hypokalemia. Hope it is clear. So the answer here is all the above. And the fluid to be avoided following trauma or surgery. Yeah, very good. So that is due to this which mechanism? Why you are saying the isotonic saline should be avoided following trauma or surgery? So that is due to which mechanism? Yeah, that is adrenocortical activity, or in other words, the answer may be like that: sodium conservation. These are the two things you should remember in this aspect. That is sodium conservation, and the other one is adrenocortical activity. Okay. So here the answer is isotonic saline. And the colloidal plasma expander used in the treatment of hypovolemic shock. What is the answer? The colloidal plasma expander used in the treatment of hypovolemic shock. I think you got trapped in the question. You didn't read the question well. And what is the question starts with? That is the colloidal plasma expander. Ringer's lactate belongs to which category? Is it a colloid or a which one? Ringer's lactate belongs to which category? It's a crystalloid. It's a crystalloid. Okay. So, and Ringer's lactate is not a plasma expander. Ringer's lactate is not a plasma expander. So, see how beautifully this question is framed. This is to trap the candidates. See, the colloidal plasma expander used in the treatment of hypovolemic shock. Once you see this hypovolemic shock, you will automatically going to answer this Ringer's lactate. Okay, but the question is like that: the colloidal plasma expander used in the treatment of hypovolemic shock. So, what could be the answer? That is 6% dextran. And the best IV fluid of choice in hypovolemic shock. If the question was like that, you should answer Ringer's lactate. Okay, and what are these plasma expander? These plasma expanders are the agents that have relatively high molecular weight and boost the plasma volume by increasing the osmotic pressure. And they are used to treat the patient who have suffered hemorrhage or shock. So these plasma expanders are the agents that have relatively high molecular weight. That is also important. Plasma expanders have high molecular weight and boost the plasma volume by increasing the osmotic pressure. So here the answer is 6% dextran. Okay, so we usually discuss 5 questions in this this short webinar, but I come across with some good questions, so I will discuss the 1, 2, 3 questions also. Okay, a 12-year-old patient presents with copious diarrhea, urine output low, and mucous membrane dry, skin turgor low. What could be the initial management? See, these are the clinical scenario questions. A lot of questions comes in last NEET. So I have put 1 or 2 questions like that also. So see, you have to read the entire thing. The patient, a 12-year-old patient present with the copious diarrhea, urine output is low, mucous membrane is dry, skin turgor is low. So what is the diagnosis? Yes, Dr. Revati, that is correct. That is dehydration. So how will you manage dehydration? That is fluid replacement. How will you manage? What are the options for fluid replacement? One is crystalloid and other one is colloids. You can manage with the Ringer's lactate, saline, dextrose, everything. And all these IV fluids have different purposes. All these IV fluids have different purposes. So once you understand the indications for IV fluids and once you understand the clinical scenario of the patient, it will be easy for you to answer the question. So you have to identify that you have to reach the correct diagnosis and you have to know the different indication for different IV fluids. That's all. So here the answer is fluid replacement. So the material required for applying pressure at IV site. One is alcohol swab, betadine swab, sterile swab, adhesive bandage. Here the answer is C, that is sterile swab. So the material required for applying pressure at the IV site. It's the IV site. It's not about the tourniquet. It's not about the tourniquet. It is at the IV site region. Okay. The alcohol swab is not recommended in the injection site. So here the sterile swab. Then the tonicity of Ringer's lactate solution. I think you must all answer this question. Which one? The tonicity of Ringer's lactate solution is. This is tonicity is actually that is isotonic. Ringer's lactate solution is isotonic. Okay, Ringer's lactate is actually isotonic, not hypotonic. Okay, so the tonicity of Ringer's lactate solution is isotonic. What is the other name for Ringer's lactate solution? What is the other name for Ringer's lactate solution? That is Hartmann solution. That is Hartmann solution. So Hartmann solution, the tonicity of Ringer's lactate solution is that is isotonic. Yes, very good, very good. And this is also very interesting. The size of IV cannula used for neonates. The size of IV cannula used for neonates. Any idea? That is 24. That is 24. The IV, the size of IV cannula used for neonates is 24. Okay, so in a nutshell, you can come to the conclusion that IV fluids belongs to basically two categories. One is crystalloid and other one is colloids. These crystalloids may recur in large volume because it crosses the semi-permeable membrane. And since it crosses the semi-permeable membrane, the fluid may not stays intravascularly for particularly long time. Okay, and colloids is basically used for plasma expanders, or it is used these colloids may retain in the intravascularly for particularly long time. So that is the difference between colloids and crystalloids. Okay, so once you understand the different indication, it is easy for you to answer the question. So since basic subjects are not covered, this is just a step to general surgery. So hope you understand the this fluids mechanism very well. So we will come up with the next next topic in a very short while. Okay,